Well, welcome to a lecture on adverse drug reactions. And I think this is really going to be a fun lecture. Keep in mind that whenever you do a SOAP note for a patient, when they come in, you always want to ask them if they have any drug allergies. If you're working in pediatrics, it's always scary if a child hasn't been on antibiotics yet. So sometimes you need to ask whether or not the mother or father have penicillin allergies or drug allergies, because sometimes that can be passed on to the infant as well. So you should know that certain adverse reactions can be life-threatening, like anaphylaxis. For instance, certain people allergic to drugs, particularly once they've been sensitized to the drug, the second dose can cause them to go into anaphylactic shock, which can cause, death. So we're going to look at adverse drug reactions today, and there's some definitions that I'd like to give you going forward with drugs in general. So when we talk about an additive effect between two drugs, basically an additive effect implies that the effect of substances or drug A and B together is equal to the sum of their individual effects. So an additive effect, technically, if they're equal to the sum of their individual effects, will indicate that if you want these two drugs to do what they're supposed to do, then they're going to do exactly what they're supposed to do, because typically they're working on, separate systems, so their sum will be equal. A permissive effect is basically when you have the presence of drug A and the presence of drug A is required for the full effect of drug B. That's a permissive. A synergistic effect is when you have drug A and B together, their effect is greater than the sum of their individual effects. And potentiation basically is indicative to synergism, but drug B has no therapeutic action by itself, and all it does is enhances the therapeutic action of drug A. So I think it's kind of potentiation and synergistic effects are kind of similar in a way, but different. So let's just review that one more time. Synergism is when you have two drugs and their effect together is greater than the sum of their individual effects. Whereas potentiation is similar to synergism, but one of the drugs really has no therapeutic use by itself, and all it does is enhances the therapeutic action of drug A. So you can think of potentiation as having your own sidekick with you. He can't really do much, but he cheers you on. So that's one way of looking at potentiation versus synergism. Whereas your antagonistic effect is where you have drug A and B together, but it's less than the sum of their individual effects. So they're basically antagonizing one another. And tachyphylaxis, which is a really interesting term, is an acute decrease in response to a drug after initial and repeated administration. So the drug has basically, they have a decrease in its effect after repeated administration. So those are some important terms, I think, to know in when drugs are being given to patients. So with that introduction, let's continue with our adverse drug reactions. So when we look at the definition of an adverse reaction, it is basically any noxious change which is suspected to be due to a drug. And you can take a minute to think about some of the reactions that you may have had to drugs.